breathe deeply and let go of any tension. Today we're going to explore one of skincare's most celebrated hydrating ingredients, hyaluronic acid. The name might sound intimidating. Acid can evoke thoughts of harsh, aggressive treatments. But hyaluronic acid is nothing like that. It's one of the gentlest, most hydrating ingredients you can use on your skin. In fact, it's already naturally present in your body, making it wonderfully compatible with your skin. Let's begin by understanding what hyaluronic acid actually is and why it's so remarkable. Hyaluronic acid is a molecule that your body naturally produces and uses in various tissues, including your skin, joints, and eyes. Its superpower is its ability to hold water, an astonishing amount of water. One molecule of hyaluronic acid can hold up to 1,000 times its weight in water. Imagine that, a single molecule acting like a tiny sponge, attracting and retaining moisture. In your skin, natural hyaluronic acid helps maintain hydration, plumpness, and suppleness. It fills the spaces between collagen and elastin fibers, creating a cushioned, hydrated environment where your skin cells can thrive. When your skin has adequate hyaluronic acid, it looks plump, smooth, and radiant. Unfortunately, as you age, your natural production of hyaluronic acid decreases. Starting in your 20s and accelerating through your 30s and beyond, your skin gradually produces less of this vital molecule. This is one reason why skin tends to look less plump and more dehydrated as we age. The good news? You can supplement your skin's hyaluronic acid through topical application, helping restore that youthful hydration and plumpness. Now let's talk about what hyaluronic acid does when you apply it to your skin. First and foremost, it's a humectant. Humectants are ingredients that attract water from their surroundings and bind it to your skin. When you apply hyaluronic acid, it draws moisture from the air and from deeper layers of your skin, bringing hydration to the surface where you can see and feel the benefits. This immediate hydrating effect is why hyaluronic acid feels so instantly gratifying. Within minutes of application, your skin feels more supple, looks more plump, and appears more radiant. This isn't just superficial. You're actually increasing the water content in your skin. Hydrated skin functions better in every way. When your skin cells are properly hydrated, they can carry out their normal processes more efficiently. Cell turnover improves, barrier function strengthens, and even oil production can normalize. Hydration is truly foundational to healthy skin. Second, hyaluronic acid helps reduce the appearance of fine lines and wrinkles. When your skin is dehydrated, fine lines become more prominent. Think of a plump grape versus a raisin. Both are the same fruit, but one has lost its water content and become wrinkled. By flooding your skin with hydration, hyaluronic acid temporarily plumps up those fine lines, making them less visible. This is especially noticeable around the eyes and mouth, where expression lines tend to form. While this effect is temporary, The hyaluronic acid must be reapplied regularly to maintain results. With consistent use, you can maintain that plumped, smooth appearance. Third, hyaluronic acid supports your skin barrier. A well-hydrated barrier is a strong barrier. When your skin is adequately hydrated, the lipids and cells that make up your barrier can arrange themselves properly, creating better protection against environmental stressors and reducing water loss. Think of your skin barrier like a brick wall. If the bricks are dry and brittle, the wall is weak. But if they're well maintained and properly moisturized, the wall is strong and protective. Hyaluronic acid helps keep those bricks in optimal condition. Fourth, hyaluronic acid has a soothing effect on the skin. While it's not specifically an anti-inflammatory ingredient, the act of deeply hydrating your skin can reduce irritation and discomfort. Dehydrated skin is often sensitive, tight, and uncomfortable. Restoring hydration naturally calms these sensations. Fifth, hyaluronic acid works for every skin type. Whether you have dry, oily, combination, sensitive, or mature skin, hyaluronic acid offers benefits. It's lightweight and non-greasy, making it perfect for oily skin. It provides deep hydration that dry skin desperately needs. It's gentle enough for sensitive skin, and it addresses the dehydration that comes with aging. This universal compatibility is one reason hyaluronic acid has become such a staple in skincare. It's rare to find an ingredient that truly works for everyone, but hyaluronic acid is one of them. Now, let's talk about molecular weight and why it matters when choosing hyaluronic acid products. Hyaluronic acid comes in different molecular sizes: high molecular weight, medium molecular weight, and low molecular weight. Each size has different properties and benefits. High molecular weight hyaluronic acid has large molecules that sit on top of your skin. They can't penetrate deeply, but they create a beautiful, hydrating film on your skin's surface. This surface hydration feels immediately comfortable and helps prevent water loss. It's like placing a moisture-locking blanket over your skin. Low molecular weight hyaluronic acid has smaller molecules that can penetrate more deeply into your skin. They deliver hydration to deeper layers, providing more lasting effects and working from within to plump and hydrate. Many modern hyaluronic acid products use a blend of different molecular weights, giving you both immediate surface hydration and deeper, longer-lasting effects. This is ideal because you get the instant gratification of surface moisture, plus the cumulative benefits of deep hydration. When shopping for hyaluronic acid products, look for those that specify they use multiple molecular weights or list different forms like sodium hyaluronate, which is a salt form of hyaluronic acid with smaller molecular size. Let's discuss how to use hyaluronic acid effectively in your routine. Timing is important with hyaluronic acid. Because it's a humectant that draws water from its surroundings, you want to apply it when there's moisture available to draw. This means applying it to damp skin. After cleansing, while your skin is still slightly damp, is the perfect time to apply hyaluronic acid. That surface moisture gives the hyaluronic acid water to bind to. If you apply it to completely dry skin, it might actually draw water from deeper layers of your skin, which can be counterproductive. Some people like to mist their face with water or a hydrating toner before applying hyaluronic acid, then mist again after. This sandwich technique ensures there's plenty of water for the hyaluronic acid to grab onto. After applying hyaluronic acid, it's crucial to seal it in with a moisturizer. Remember, hyaluronic acid is a humectant, not an occlusive. It draws water to your skin, but doesn't prevent it from evaporating away. You need to lock in that hydration with a cream or lotion that contains occlusive ingredients. Think of it as filling a bucket with water, hyaluronic acid bringing hydration, and then putting a lid on it, moisturizer preventing evaporation. Both steps are necessary for optimal hydration. You can use hyaluronic acid both morning and night. It layers beautifully under sunscreen in the morning and under heavier night creams in the evening. Many people apply it after cleansing and toning, before serums and moisturizers. Hyaluronic acid is also available in different product types: serums, essences, moisturizers, and even sheet masks. Serums tend to have higher concentrations and allow for more precise layering with other products. Moisturizers with hyaluronic acid give you hydration and occlusion in one step, which is convenient. The concentration of hyaluronic acid in products typically ranges from 0.1% to 2%. You don't need extremely high concentrations to see benefits. Even lower percentages are effective when formulated properly. One important consideration: climate matters when using hyaluronic acid. In humid environments, hyaluronic acid has plenty of water vapor in the air to draw from, making it extremely effective. But in very dry environments, think desert climates or heated indoor spaces in winter, there may not be enough moisture in the air for hyaluronic acid to bind. In these dry conditions, hyaluronic acid might draw water from deeper layers of your skin instead of the environment, potentially leading to increased dehydration. The solution is simple. Use a humidifier to add moisture to the air. Apply hyaluronic acid to damp skin with an occlusive moisturizer on top, or consider using it in combination with other hydrating ingredients that work differently. Are there any downsides to hyaluronic acid? Very few. It's extremely well tolerated, and allergic reactions are rare. Some people with very sensitive skin might react to certain formulations, but this is usually due to other ingredients in the product rather than the hyaluronic acid itself. One thing to be aware of: some lower quality hyaluronic acid products can feel sticky or pill up under other products. This is usually a formulation issue, not a problem with hyaluronic acid itself. If you find your product feels uncomfortable, try a different brand. Hyaluronic acid also works beautifully with other ingredients. It's compatible with virtually everything: vitamin C, retinol, niacinamide, AHAs, BHAs, it can actually help buffer potentially irritating ingredients, making them more tolerable. Let's address some common questions about hyaluronic acid. Can you use too much? Not really. Your skin will absorb what it can use and the rest will sit in the surface, which isn't harmful. However, layering multiple hyaluronic acid products may be redundant. One good serum is usually sufficient. Does it work immediately? You'll notice surface hydration almost instantly. Your skin will feel more supple and look more dewy within minutes. However, deeper, more significant improvements in skin texture and fine lines require consistent use over several weeks. Can it replace moisturizer? No. Hyaluronic acid is a hydrator, not a moisturizer. Hydration refers to water content, while moisturizing refers to preventing water loss and replenishing lipids. You need both for optimal skin health. Is it safe during pregnancy? Yes, hyaluronic acid is considered safe during pregnancy and breastfeeding. It's a naturally occurring substance in the body, and topical application poses no known risks. As we close our time together, remember that hyaluronic acid is one of skincare's true heroes, a gentle, effective, universal ingredient that simply helps your skin do what it already wants to do: stay hydrated, plump, and healthy. It doesn't force dramatic changes or cause irritation. It simply supplements what your skin naturally has but loses over time. This is skincare at its best, working with your body, not against it. Take a deep breath in and release it slowly. Consider how you might incorporate hyaluronic acid into your routine, or if you're already using it, appreciate the gift of hydration it's giving your skin. May your skin be deeply hydrated, plump, and radiant. May you choose ingredients that truly nourish and support you. May you find joy in this simple act of care. Thank you for this time together. Be well and be gentle with yourself.
Maintenance, their acne stays controlled. This suggests that excessive barrier compromise actually worsened acne by disrupting skin function. Prevention is better than recovery. From the start of acne treatment, use appropriate concentrations and frequencies, incorporate moisturizing and barrier support, and listen to your skin's signals. If your skin is becoming very dry, tight, or reactive, reduce treatment intensity rather than continuing and causing more barrier damage. Long-term consistency matters more than short-term intensity. Guide 27: Cosmeceuticals and Advanced Skincare Ingredients Beyond Standard Acne Treatments. Beyond the well-established acne treatments like benzoyl peroxide and salicylic acid, numerous cosmeceutical ingredients support acne treatment and skin health. Understanding these advanced ingredients allows you to optimize your acne regimen and support overall skin function. Peptides are short chains of amino acids that support skin structure and function. Some peptides have been studied for acne-supportive effects through anti-inflammatory mechanisms and barrier support. Matrixyl and similar peptides appear in many skincare products. While peptides aren't primary acne treatments, they support overall skin health and resilience. They're generally gentle and well tolerated. Include peptides in your routine for general skin support without expecting them to treat acne directly. Hyaluronic acid is a humectant that holds up to 1,000 times its weight in water, providing significant hydration. While it doesn't treat acne, maintaining proper hydration through hyaluronic acid improves skin function and barrier health. Using hyaluronic acid serums or moisturizers provides hydration support for acne-prone skin. Squalane is a lightweight oil that mimics skin's natural sebum without being comedogenic in most individuals. It provides hydration and lipid support for barrier function. Squalane is particularly useful for acne-prone skin that needs lipid support without the pore-clogging risk of heavier oils. A few drops of squalane can be added to moisturizer or serum for enhanced hydration. Niacinamide, vitamin B3, has multiple beneficial effects for acne-prone skin. It has mild antibacterial and anti-inflammatory properties, reduces sebum production, minimizes pore size, and strengthens the skin barrier. At 4 to 5% concentration in serums or moisturizers, used daily, niacinamide provides noticeable benefits. It's also gentle enough to use with other actives without concern. Alpha-lipoic acid is a powerful antioxidant that penetrates both water and lipid layers of skin. It reduces inflammation, supports barrier function, and has some evidence for acne reduction through anti-inflammatory mechanisms. Alpha-lipoic acid is typically used in serums at 5% concentration, applied daily. It's generally well tolerated but can cause mild irritation in very sensitive skin. Ferulic acid is a plant-derived antioxidant that works synergistically with vitamins C and E for enhanced antioxidant protection. Ferulic acid also has direct anti-inflammatory effects. It's commonly found in advanced serums and provides additional antioxidant support beyond vitamin C alone. Resveratrol is a potent antioxidant from plants like grapes. It reduces inflammation and has some antimicrobial properties. While not a primary acne treatment, it provides useful antioxidant support. Resveratrol is often combined with other antioxidants in advanced serums. Bakuchiol is a natural retinol alternative derived from the babachi plant. It provides retinol-like benefits including increased cell turnover, collagen stimulation, and anti-aging effects without being a true retinoid. Importantly, bakuchiol doesn't cause photosensitivity or irritation like retinoids, making it suitable for very sensitive skin or as an alternative for those who can't tolerate retinoids. For acne specifically, bakuchiol is less powerful than tretinoin or retinol, but provides useful cellular turnover support. Salicylic acid analogues include beta-hydroxy acids beyond standard salicylic acid. LHF, lipohydroxy acid, is similar to salicylic acid but slightly milder, making it suitable for sensitive skin. These salicylic acid analogues provide exfoliating benefits with potentially less irritation than standard salicylic acid. Azelaic acid, beyond its use for hyperpigmentation, has direct acne-fighting properties. At 10 to 15% concentration, azelaic acid has antibacterial, anti-inflammatory, and anti-keratinizing effects. It's a versatile ingredient useful for acne, rosacea, and post-inflammatory hyperpigmentation simultaneously. Botanical extracts like tea tree oil, witch hazel, and green tea have mild antibacterial and anti-inflammatory properties. While weaker than pharmaceutical actives, they provide supportive benefits. Many skincare products combine multiple botanical extracts for cumulative benefit. These are generally well tolerated, making them suitable for sensitive skin seeking some acne support without strong pharmaceutical actives. Retinaldehyde, also called retinol, is a retinoid intermediate between retinol and retinoic acid. It's slightly stronger than retinol but weaker and less irritating than tretinoin. For those finding tretinoin too strong or seeking stronger benefits than retinol provides, retinaldehyde is an excellent middle ground. It's increasingly available in advanced skincare products. Encapsulation technology makes some ingredients more stable or less irritating. Encapsulated retinol, for example, releases gradually over time, reducing irritation while maintaining effectiveness. Similarly, encapsulated vitamin C remains stable longer and is less irritating than non-encapsulated forms. Time-release technology delivers ingredients gradually rather than all at once. This reduces initial irritation while providing extended benefits. Some treatments use time release to deliver benzoyl peroxide or salicylic acid gradually throughout the day. Polyhydroxy acids, PHAs, like gluconolactone and galactose are gentler exfoliants than AHAs and BHAs. PHAs have larger molecular structures that penetrate more slowly, making them suitable for sensitive skin or those who can't tolerate standard exfoliants. They provide exfoliating benefits with less irritation. Using cosmeceuticals strategically enhances your acne regimen. For example, you might use salicylic acid for exfoliation, benzoyl peroxide for bacterial control, then add niacinamide serum for sebum control and barrier support, followed by a hyaluronic acid serum for hydration and a moisturizer with peptides for skin support. This multi-ingredient approach addresses multiple aspects of skin health. However, avoid the trap of skincare complexity. More products don't automatically mean better results. Focus on core treatments: cleanse, treat with proven actives, moisturize, protect, then add supportive ingredients. A simple routine with proven actives beats a complex routine with unproven ingredients. Guide 28: Acne and Mental Health, Psychological Impact and Management Strategies. Acne's psychological and emotional effects are profound and often underestimated. Understanding acne's mental health impact and implementing strategies to manage the psychological component is essential for overall well-being during acne treatment. The psychological burden of acne is real and significant. Studies consistently demonstrate that acne causes depression, anxiety, reduced self-esteem, and social withdrawal in many sufferers. This burden is disproportionate to acne's physical severity. Even mild acne can cause substantial psychological distress, while severe acne might cause less psychological impact in individuals with resilient self-image. Visible acne, particularly on the face, affects how others perceive you and how you believe others perceive you.
Welcome, and thank you for choosing to spend this time caring for your skin and yourself. Let's begin by taking 3 slow, peaceful breaths together. Inhale deeply through your nose, feeling your shoulders drop and relax, and exhale gently through your mouth. Once more, breathe in tranquility and breathe out any worries about your skin. One final breath in, feeling present and centered, and breathe out completely. Wonderful. Today we're going to explore rosacea, a common but often misunderstood skin condition that affects millions of people. Understanding what causes those persistent flushes and how to care for sensitive, reactive skin. Rosacea is a chronic inflammatory skin condition characterized by facial redness, visible blood vessels, and sometimes bumps that can resemble acne. It typically affects the central face, including your cheeks, nose, forehead, and chin. While rosacea can be frustrating and sometimes affects self-confidence, understanding this condition empowers you to manage it effectively. With proper care and trigger avoidance, most people with rosacea can significantly reduce flare-ups and maintain calmer, more comfortable skin. Let's start by understanding what rosacea actually is. This condition involves dysfunction of your facial blood vessels, leading them to dilate more easily and remain dilated longer than normal. This creates the persistent redness that characterizes rosacea. The exact cause isn't fully understood, but rosacea involves a combination of genetic predisposition, immune system abnormalities, and environmental triggers. It's not caused by poor hygiene, alcohol abuse, or any behavior you should feel embarrassed about. Rosacea is a legitimate medical condition deserving of proper care and treatment. Rosacea has 4 main subtypes, though many people experience features of multiple types. Erythematotelangiectatic rosacea, or ETR, is characterized by persistent facial redness and flushing visible blood vessels called telangiectasias, and often sensitivity and burning sensations. This is the most common subtype. Papulopustular rosacea resembles acne, with red bumps and pus-filled pimples alongside persistent redness. This type is sometimes called acne rosacea, though it's distinctly different from true acne. Phthimatis rosacea causes skin thickening, most commonly on the nose, creating a bulbous appearance called rhinophyma. This subtype is less common and typically affects men more than women. Ocular rosacea affects the eyes, causing redness, dryness, irritation, and sensitivity to light. Eye symptoms sometimes appear before skin symptoms, and ocular rosacea requires evaluation by an eye doctor to prevent complications. Many people experience features of multiple subtypes, and your rosacea may change over time. Who gets rosacea? This condition typically develops in adults between ages 30 and 50, though it can occur earlier or later. People with fair skin are more prone to rosacea, particularly those of Celtic or Northern European descent, though it occurs in all skin tones. Women develop rosacea more frequently than men, but men often experience more severe symptoms, particularly phthimatis changes. Having a family history of rosacea increases your risk, suggesting a genetic component. Rosacea is often mistaken for other conditions. The facial redness might be confused with general sensitivity, sun damage, or simply being prone to blushing. The bumps can look like acne, leading to inappropriate treatment with harsh acne products that worsen rosacea. Some people live with rosacea for years before getting an accurate diagnosis, treating it ineffectively because they don't understand what they're dealing with. If you suspect rosacea, seeing a dermatologist for proper diagnosis is valuable. What triggers rosacea flare-ups? Understanding your personal triggers is crucial for managing this condition. Common triggers include temperature extremes, both heat and cold. Hot weather, saunas, hot baths, and even hot beverages can cause flushing. Cold weather and wind can also trigger flares. Sun exposure is one of the most common triggers, with UV radiation causing inflammation and vasodilation. This makes daily sun protection absolutely essential for managing rosacea. Certain foods and beverages trigger rosacea in many people. Spicy foods, hot drinks, alcohol, particularly red wine, and histamine-rich foods like aged cheeses and cured meats are common culprits. However, triggers are individual. You might tolerate foods that cause severe flares in someone else while reacting strongly to something others handle fine. Keeping a symptom and trigger diary helps you identify your specific triggers. Stress and emotions powerfully affect rosacea. Strong emotions, whether positive or negative, can trigger flushing and flares. Chronic stress worsens overall rosacea severity. While you can't eliminate all stress, developing stress management techniques genuinely helps control rosacea. This might include regular exercise, meditation, deep breathing practices, or whatever helps you feel more balanced and calm. Skincare products and routines can trigger or worsen rosacea. Harsh cleansers, alcohol-based toners, physical scrubs, and products with fragrances or essential oils frequently cause problems. Many common skincare ingredients are simply too irritating for rosacea-prone skin. Even products marketed for sensitive skin might contain hidden irritants. Learning which ingredients to avoid is essential for managing rosacea. Certain medications and supplements can trigger rosacea. Vasodilators, medications that widen blood vessels, often worsen flushing. Some blood pressure medications, niacin supplements, and even some topical medications applied to the skin can trigger flares. If you notice rosacea worsening after starting a new medication, discuss this with your prescribing doctor. Don't stop prescribed medications without medical guidance, but awareness of potential connections helps you and your doctor make informed decisions. Now let's discuss how to care for rosacea-prone skin. The foundation is a gentle, minimal routine. Rosacea skin doesn't tolerate complicated multi-step routines with many active ingredients. Simple is better. Focus on cleansing gently, moisturizing adequately, and protecting from the sun. This minimalist approach gives your skin the best chance to calm down and stay calm. Choose cleansers specifically formulated for sensitive skin. Look for cream or lotion cleansers rather than foaming formulas, as foaming agents can be irritating. Avoid cleansers with sodium lauryl sulfate, fragrances, essential oils, or alcohol. Your cleanser should have a neutral or slightly acidic pH and feel gentle, never stripping or tight. Use lukewarm water, not hot or cold, as temperature extremes trigger flushing. Pat your face dry gently with a soft towel rather than rubbing. Moisturizer is crucial for rosacea skin. A compromised skin barrier is common in rosacea, and keeping your skin well hydrated strengthens this barrier. Look for fragrance-free, hypoallergenic moisturizers with barrier-supporting ingredients like ceramides, niacinamide, and fatty acids. Avoid heavy occlusives that might trap heat, and avoid products with potential irritants. Apply moisturizer to slightly damp skin to lock in hydration. Sun protection is non-negotiable for managing rosacea. UV exposure is one of the most consistent triggers across all rosacea sufferers. Use a broad-spectrum sunscreen with at least SPF 30 every single day. Mineral sunscreens with zinc oxide or titanium dioxide